Now, the figures are shocking. 1 in 5 Australians battle chronic pain every day, with many turning to medication for help.
But there are some new solutions which could help ease the suffering. So joining us now from Melbourne is neurosurgeon Dr. Wong and chronic pain sufferer Silvana Loschiavo. Dr. Wong, firstly to you, just how hard is it to diagnose and treat chronic pain?
It's very, very difficult because a lot of those conditions are not being properly managed, and they're often not getting the right information and do the right thing to help the patients.
I mean, it's really interesting that chronic pain is the #1 reason why most people go to see their doctor. Silvana, can I just ask you to explain your experience for us?
I had a bulging disc which was compressing on my nerves, so it was really affecting my legs, making it difficult to walk, and yeah, I was just in constant pain.
How long were you in the pain for before you sought treatment?
I was seeking treatment beforehand, so I had rehab on my back. I had a cortisone injection in my back, but 6 months prior to my surgery, I ended up in hospital because I couldn't feel my legs, and that's when something serious needed to be taken.
And so for you, the serious action was surgery. Was that successful?
Very successful. I noticed a difference straight away because I used to get shooting pain down my legs, and after surgery I didn't have that anymore.
Dr. Wong, in terms of treatment options, where is the best place to start?
Really, I always explain to patients a common sense approach. The first thing to do is really just have a good rest and maybe take a few days off and take some simple medication like paracetamol, and also just stay away from all the lifting and bending, and that probably would fix most of the simple back pain.
If that doesn't work though, what are the next steps?
The next step then probably is simple muscular therapy like physiotherapy, gentle non-impact type exercise like gentle swimming, and that would also be another layer of treatment to help patients.
But how do you rest though? If you've got back pain and some of the rest is to, I guess, lie down on your back, how does that help if that's causing you discomfort or pain?
It's very difficult initially, and that's where some of the medication, simple medication, comes in hand, as well as some muscle relaxants can help as well.
And I know that, I mean, you were just talking about it there, Silvana, before you moved to the more extreme case of having surgery, that you actually tried a spinal injection. When is that the best option, doctor?
Well, that's when, rest and simple exercise is not helping. And, simple injection, spinal injection can be very helpful. But I always say that, firstly, you need to have the proper scan and have the correct diagnosis as the cause of the back pain.
Doctor, at what point do you have to go for surgery, and how complicated is that surgery?
I think, again, from a common sense approach, if you fail the rest, the medication, the exercise and the injection, then next step, given the correct diagnosis, then surgery can be very effective in removing the source of pain.
Now, I was having a read this morning that for some patients that even surgery is not effective, but one thing that they're now looking at is cognitive behavioural therapy. Is that something that you think can work?
It's not something can work, but one needs to recognize that not every patient is as lucky as Silvana that can have the correct treatment and therefore remove the source of pain. And if you can't, in some unfortunate patients, then the cognitive therapy or the psychological therapy can help them to deal with the chronic conditions better.
So this idea of mind over matter is what you're talking about, because I've heard of it being used for patients who suffer from depression, but never from any kind of physical pain.
Well, I think, if you can't resolve the physical pain, they are going to have to bear with it for a long time. Then the psychological support of therapy is a very important part of the treatment.
Silvana, so you turned to surgery.
Yes.
How are things now?
Things are so much better. I've got movement because I have 2 young kids, so I can spend quality time with them too.
And so there's no pain?
At the moment, because I'm recovering from a second surgery on my neck, I've got pain, residual muscular pain from that.
But is that better than how things were?
Much, much better, because I lost sensation in my hands and my arms, so heaps better.
Dr. Wong, can I ask you, why is it that so many people seem to suffer from chronic back pain? Is it something to do with the lifestyles we're living these days?
I think lifestyle, but also, you know, we all do have chronic back pain as we get older. It's just part of aging. But it's about managing our spinal health better in avoiding injury and therefore prolong our longevity in many ways.
So, sitting up, back straight.
That's it.
That's a good way to start. Every time over the years when I do a story or an interview on back pain, I shoot
Fix
straight
your
up.
posture.
It only lasts for a couple of minutes, and then I sort of start slouching again. But anyway,
Good
Dr.
posture.
Wong and Silvana, thank you so much for joining
Thank
us
you.
this morning. It is National Pain Week this week, which is all very interesting. Thanks.
Well, children's